Healthcare Value Management. This is the name of the company that I chose to set up after health planning ended in my career in over 20 years of getting skills and learning about health planning, how that ended up my going into a new company called Healthcare Value Management. And this lecture is telling you what the issues were, what we did, and what skills we had developed in health planning that allowed us to set up this new company. The end of health planning. The federal government stopped funding 15 years of community health planning. It closed 205 regional health planning agencies across the country and 50 state health planning agencies also throughout the country. This was caused by a serious pressure from the hospitals that were irritated by health planning agencies offering comments to state governments on new technology, the need for more hospitals. It was the fourth time I needed to look for another job. We worked a lot with the building of trade unions to support their health insurance plans. Many of the unions asked if we could keep working with them somehow when our health planning agency had to close down. I asked my longtime friend, Gregory Bulger, if he would like to set up a company with me as a partner. Greg was an administrator of a self-funded union health and welfare plan. He also founded the Mattapan Community Health Center in Mattapan, part of Boston. He was familiar with provider billing systems. This is an issue anybody wanting to set up their own company would have to deal with. In some previous lectures, I talked about Jonathan Fielding setting up his own company after leaving Massachusetts as health commissioner. Many of the same issues we had to deal with. We had a spare room in my home. We saved on rent. My wife borrowed a computer from her work. I did all the typing for the new company. I asked all of our union friends who had an interest in our working with them to send us a letter indicating their interest in our representing them. We needed these letters from the unions to show the hospitals their interest. We had unions representing 50,000 workers that gave us a letter of support. We eventually had 500,000 members. We wrote physician groups at all the teaching hospitals, inviting them to join our network. We eventually had 25,000 physicians. We knew Shields MRI from a certificate of need program where we had worked with them. They had an early interest in NMRs, which they changed the name to MRI. The N was for nuclear, which everybody was afraid of. We guaranteed that our hospitals would be paid within 5 days of when they got the third-party administrator bills. Third-party administrators paid the bills for self-insured unions. The Health Planning Council for Greater Boston was asked by over 30 building trade unions to help them improve their self-funded health plans. They invited 4 corporations to join them. We wrote up a request for proposals, an RFP, for third-party administrators. TPAs had utilization review companies that they often worked with. They had reinsurance companies and disease prevention services. We sent the RFP out to all of the companies that the unions wanted to hear from. We got 3 to 5 responses from each area. Each company came in for an interview. The unions then decided who they wanted to work with. They chose 3 different third-party administrators. TPAs paid the hospitals and other provider bills. We required them to pay bills in 5 days. Unions bought reinsurance for catastrophic cases. They would have insurance for $25,000, $50,000, $100,000 cases. Some unions wanted members to have doctors review proposed hospitalizations and offer another opinion to the members. They often had a company do this work. Some unions wanted members to receive further education on preventing diseases. We hired a cardiologist to work unions on preventing heart disease. Each of our building trade unions clients had a different company doing work as a TPA, reinsurance, utilization review. we let our cardiologists work for them. Our cardiologist taught courses on preventive medicine. He talked about diet and exercise being important. The operating engineers then would get lunch at a van called the Roach Coach. They got lunch there in front of the Dana-Farber Cancer Center in the Children's Hospital in Boston. The union guys asked how the Roach Coach made their sandwiches. Did they use preservatives in their meats? The coach said that all sandwiches are made with preservatives. The union guys said that their cardiologist, Dr. Evans, told them not to eat preservatives. Could they make sandwiches with fresh tuna fish, fresh chicken salad? The coach said that they could, but it would be more expensive. The union guys said that's okay. The doctors and the nurses noticed that the union guys were getting sandwiches from the corner of the van. The doctors and nurses asked what the union guys were getting. The coach said that the union guys' cardiologist told them not to eat preservatives. The doctors and nurses asked for the same fresh meat as the unions. Everyone followed the union's cardiologist, Dr. Evans. A hospital in New Hampshire refused to join the Healthcare Value Management Network. A large year-round motel in its area had an annual meeting of all of the motels it owned. The motel chain announced a new health plan that all of the motels in the chain had access to, except the New Hampshire motel. The hospital for the New Hampshire motel would not join the HCVM network. The New Hampshire motel director went back to the New Hampshire hospital and told the administrator to call HCVM and join the network, or he would be out of a job. There are a lot of small hospitals and physician groups in New Hampshire, Vermont, and Maine. We had a lot of clients in the rural areas that would go to the doctor's offices, sign them up for our network. Insurance companies usually pay obstetricians twice as much money for a C-section than a standard normal delivery. We paid the same rate for a C-section as a normal delivery. We were thanked by some obstetricians for not encouraging unnecessary C-sections. Some obstetricians refused to join, who later joined when they lost too many patients. I went to the plumbers' union hall where there was a vote of several of the unions to leave Blue Cross of Mass to join Healthcare Value Management Network. There was a Boston City Hospital ambulance in front of the union hall. I asked if somebody was ill. The answer was that the emergency department at Boston City Hospital knew there was a vote to leave Blue Cross that night at the Union Hall, and there might be some violence at the hall. They should have an ambulance there. 4 unions voted to join HCVM and leave Blue Cross with no violence that night. In addition to New England unions and employees using HCVM, national employers use HCVM. Most national employers who were self-insured had employees in Boston. They wanted to use our network. We would give them, the Boston clients, access to our discounts at Boston hospitals. Some of these national networks became interested in buying HCVM. They needed to access a network in Boston. Blue Cross of Mass was interested in HCVM. I got a telephone call in 1993 from the president of Massachusetts Blue Cross Blue Shield, who had been president of Blue Cross Blue Shield in Michigan. They had all the large unions in Michigan as clients. He asked his staff when he became president of Blue Cross Blue Shield of Massachusetts, how many of the large unions were members of Blue Cross Blue Shield of Massachusetts. His staff said none were members. They were all members of HCVM in Norwood with Charles Donahue. He asked who HCVM was and called me. I met the Massachusetts president of Blue Cross Blue Shield. He wanted to buy HCVM.